Let's quickly understand the flexor muscles of forearm. In superficial layer, we have 4 muscles and 1 intermediate muscle. So from lateral to medial, we have pronator teres, this one. The humeral head origin is from medial epicondyle and the ulnar head from coronate process of ulna. The insertion is on lateral surface of radius. Second is your flexor carpi radialis. We can see that from here to here. Its origin is from the medial epicondyle and the insertion is on the base of second metacarpal. Now, the third one is the palmaris longus. We can understand it by the long tendon. Origin from medial epicondyle and insertion is from the flexor retinaculum and palmar aponeurosis. It goes over the flexor retinaculum. Now, the fourth one is your flexor carpi ulnaris. The origin, humeral head from medial epicondyle and the ulnar head from the olecranon process and the posterior border of ulna. And the insertion is on the pisiform hook of Hammett and the base of fifth metacarpal. Now, just beneath them, we have the flexor digitorum superficialis. So, origin, it has two heads for humero-ulnar head, medial epicondyle and coronate process, and the radial head is from the anterior oblique line of shaft of radius. Now, the insertion is on the side of middle phalanges of 2 to 5 digits. We can see that. Now, the nerve supply is all superficial muscle of forearm is supplied by the median nerve. Exception is flexor carpi ulnaris, which is supplied by the ulnar nerve. Let's quickly revise the deep flexor muscles of forearm. The first one is the flexor pollicis longus with the nerve supply of median nerve. The origin is from the anterior surface of radius and the interosseous membrane, and the insertion is on the base of distal phalanx of thumb. You can see. The second one is the flexor digitorum profundus. This one, we can see it from here. This is the flexor digitorum profundus and it is laterally half by anterior interosseous nerve supplied and medially half by the ulnar nerve. Now, its origin is from the proximal 3/4 of anterior and medial surface of ulna and the insertion is on the distal phalanx of digits, that is 2 to 5. Now, the third one is the pronator quadratus muscle, this one, and supplied by the median nerve. Its origin is from the distal 1/4 of anterior ulna and the insertion is on the distal 1/4 of the anterior radius. We can see that. Now, the movements and action of forearm flexors. First is the flexion of wrist by superficial and deep muscles except pronator teres. Second is the flexion of fingers by flexor digitorum superficialis and profundus muscle. Third is the pronation by pronator teres and quadratus. Fourth one is the flexion of thumb by the flexor pollicis longus muscle. This is the flexion. Now, fifth one is the abduction and adduction. This is abduction by flexor carpi radialis. And this one is the adduction by flexor carpi ulnaris. Thank you.